So I support this measure, Madam Speaker. I support this bill. Discretionary sentences and diversion from prison are distinctly preferable to mandatory minimum sentences that lock up more Canadians for longer time to no positive effect. But make no mistake, this bill will do nothing, zero, to address the core problem with drug policy in this country, and that is to treat drug addiction and substance use as health, not criminal issues. And, Madam Speaker, that is the root cause of the problem with drug policy in this country. Substance use and addiction are health issues, not criminal ones. They are not moral failings. They are not issues of character. They are pure issues of health. Addiction is a complex biopsychosocial illness. It results in compulsive behavior that is rooted in trauma. Substance use disorder is listed in the DSM-5, which is the diagnostic manual that medical professionals use in this country. Now, this is one of those issues, Madam Speaker, where I will say that the general population is far ahead of the politicians of this country, and dare I say, many politicians in this House. And that is because no family in this country, not one, is untouched by addiction or substance use disorder. Everyone has a mother or father, a sister or brother, an uncle or aunt, a cousin, a grandparent, or maybe even themselves, who have suffered from substance use, whether that's alcoholism or addiction. And these families know something that I think is really important to acknowledge in this House. Those people who are suffering are not criminals. They are sufferers. They are patients. They are people struggling with an illness. Dr. Gabor Mate, who I consider to be an authority of global stature in our countries, a great Canadian, has found that the basic cause of addiction is trauma. He is on record as saying, after treating people on the downtown east side of Vancouver for many years, he never treated a single person, not one, who did not have significant childhood trauma. So what does criminalizing those people do to them? Well, criminal sanctions are society's way of imposing maximum trauma on citizens. You get accosted by the police. You go through the trauma of arrest. You go into the very serious, intimidating context of a court. You go through a trial. You go to jail. This system is designed to impose the most serious pressure society can possibly do. So in other words, what we do when we criminalize drug policy is we re-traumatize people whose main issue is that they suffer from trauma. That's completely counterintuitive. In fact, it's cruel. And it does not work. If criminalizing drug use worked, Madam Speaker, we would have eliminated it years ago. We have spent billions of dollars, incarcerated millions of people around the world, harmed tens of millions of people, and achieved nothing. Today, Canada is setting year after year record deaths in opioid overdose. Every year since this government was elected in 2015, the death rate has gone up. Since 2016 till 2020, over 17,000 Canadians have died. In BC, 6.5 people die every day. So, Madam Speaker, I'll conclude by saying stigma, shame, and punishment are the core emotional issues of those suffering from substance use disorder, and criminalizing their behavior exacerbates and deepens that shame and stigma. We don't need to get rid of mandatory minimum sentences. Madam Speaker, we need to decriminalize drug use, bring in a regulated, low-barrier, safe supply, focus on education, prevention, and have treatment on demand through our public health care system. Then we will make progress on drug policy and use in this country. Thank you, Madam.